It's Teresa from Life Beyond Diabetes, and this week we're talking about ways of eating that are recommended for people with type 2 diabetes as part of that lifestyle treatment that we always talk about for type 2 diabetes. Yesterday we talked about carb counting and why paying attention to carbohydrates is so important for people with type 2 diabetes, how it's related to insulin resistance. Today I'm going to talk about the basic low carbohydrate diet. Just a quick review that carbohydrates, when I'm talking about carbohydrates, the biggies that I'm talking about are flour, rice, corn, sugar, and potatoes. And basically also all plants, but the further the plants get from looking like what they were when they came out of the ground or came from the farm, for instance, an apple has some carbs, but it also has a lot of fiber. So probably, when we're looking at net carbs, not as much of it can be used as sugar as if you compare that to apple juice that looks nothing like the apple that grew off the tree. That apple juice is almost purely sugar, and frankly may as well be drinking a soda for the most part. So we're looking at how much sugar is net carbs. Total carbs minus fiber, total carbs. So that's what we're counting. In a typical American diet, which is true across most industrialized countries, people eat anywhere from 300 to 500 grams of carbohydrates a day. That is not low carb at all. And that is in things like bread, pasta, potatoes, desserts, juice, smoothies, all those extra things where sugar is added. And when we're talking about a low carbohydrate diet, people define that in many different ways. That can be anywhere from 50 to usually about 200 grams of carbohydrates is considered low carb by some. Most people who are talking about low carb for diabetes are looking at less than 150 grams of net carbs. I will tell you, in my practice personally, I recommend that people eat somewhere between 50 and 100 grams of net carbs, depending on a variety of factors, and it's very individualized. And again, like with all things, I would want you to speak with your own individual provider, your medical provider, to help you figure out what your goal should be for a low carbohydrate diet if you decide that this is the way for you to go. First, I want to make sure I give a safety warning here. There is a concern with low carbohydrate diets if you are taking insulin or if you're taking one of the drugs that causes your body to release its own insulin, and that would be a drug that in the class of the sulfonylureas. So in the US, those are drugs such as glimeperide or gliburide or gliburide. And the reason for that is that if you suddenly significantly reduce your carbohydrates, your body is, the drug doesn't know that you're not, that you don't have that much sugar on board anymore. It's still trying to cover that, and you will get some very significant low blood sugars. So if you are taking one of those drugs, you definitely need to speak with your medical provider to adjust your medication before starting a low carbohydrate diet. Now, most providers are very willing to help support their patients in lowering their carbohydrates, because the goal, of course, is to need less medication. So if we're going to treat our diabetes with lifestyle, we want to be able to use less medication if we don't need it. So one of those things is to cut some of those carbohydrates out of your diet so you don't need as much medication. So definitely run this by your medical provider to make sure that there's not going to be a danger for you if you significantly cut carbohydrates out of your diet. So once you've decided that you're interested in cutting some of those things out, there's two major ways that you can go about doing that. The first one is to just kind of gradually look at what you're eating and say, you know what, I'm eating too much bread. Let's just get rid of some of that bread. Eating too much pasta. Let's cut some of that out. You know what? I do not need to drink soda every day. I don't need to have a smoothie. Look at the places where you have carbohydrates that are extra that you just feel like, you know what, this is an easy place for me to say, I don't need this anymore. And choose one at a time and grab and let them go and say, you know what, I don't do that anymore. I don't eat potatoes anymore. And that is it's a slow way to go, but you know what, it's moving in the right direction and it'll get you there. So that is one of the ways that I recommend for people who don't want to do something drastic or who are concerned and legitimately concerned that if they make a drastic change, it's not going to stick. I'd rather have you make a slow change that's going to stick than a drastic change, an all or nothing, like, oh, I'm going to do it all, and then have it, you know, it doesn't stick. So I want you to look at those 5 major categories and see where you can drop some of those things out of your diet. So that's one way to do it. And that doesn't take a lot of research. You know, you can just probably look at what you're eating today. You know, what are you going to fix for dinner? Okay, I'm making pasta. Well, maybe instead of pasta, you could choose cauliflower with that. Or you could have half the pasta or half the rice. That's going to cut your carbohydrates down significantly. So that's one way to do it. The second way is significantly more drastic, but the results you'll see are also much more dramatic. And that would be to cold turkey cut your carbohydrates down to somewhere between 50 and 100 grams of net carbohydrates a day. And that takes a lot of planning and a lot of discipline to do. And how I usually recommend that clients do that is that they follow a meal plan or they create their own meal plan. It takes a lot of research. You have to look at nutrition labels, or you have to find a meal plan. Now, I do have a meal plan. A lot of you already have that meal plan that you can look at. I'll also post the link in this video so you can download the meal plan if you need that. All the days on the meal plan are do fall under that 50 to 100 grams of net carbs daily. So that plan falls under this thing. And so the reason I recommend that is that you don't have to think, you don't have to deal with temptation if you know that this is what I'm going to eat on this day. Now, that doesn't mean that you have to be super rigid about eating. If you choose, popcorn chicken for lunch on Tuesday, but when lunch on Tuesday rolls around, you don't want popcorn chicken, you want chili, leftover chili from the night before, you can swap that out, but you're still eating something that's on the meal plan and something that falls within your plan. So you don't have to eat it rigidly at the time that it was assigned, but you need to stick with the plan. And again, I want you doing this for a minimum of a week, preferably 2 to 3 to 4 weeks, planning every single thing that you're going to eat. And there's a few reasons for that. One, it gets you into the habit. It gets you over feeling the, sometimes people feel some side effects from dramatically cutting their carbohydrates. They might get a little tired. They might get some headaches in the first couple days. I will tell you those symptoms usually pass almost immediately, and a lot of times if you just increase your water intake, taking care of your body, those symptoms go away. But if you're doing this for 3 to 4 weeks, your body starts to feel really great. You know what it feels like to be feeding your body the food it's supposed to have. And also your blood sugar numbers are going to be phenomenal. You're going to be able to see it on your meter. You'll see the difference between what it looks like when you are eating your standard American diet versus a low carb diet, and how it nourishes your body and affects your diabetes. It's amazing. I love looking at the numbers when I'm eating the way I'm supposed to be eating. Anyway, so that's the low carb diet. I'm super happy to help you with any questions you have about that. Again, if you're taking insulin or a sulfonylurea, you definitely need to talk to your medical provider before you start cutting carbs drastically. Now, you can cut maybe a serving of bread here and there, but I definitely, before you do much cutting of carbohydrates on either of those kinds of drugs, you definitely need to talk to your medical provider, because I want you to be safe about it. But otherwise, get going. Get some carbs out of your diet. Let's get those blood sugar numbers under control. This is a sustainable way to eat. I promise you will get used to not eating as much bread and pasta. Life can thrive. You can survive and thrive without bread and pasta, or with a smaller amount of bread and pasta. I do. A lot of my friends do. I feel fantastic. So if you have any questions about low carb diet, drop me a comment, drop me a DM, send me an email. I'll get back to you or cover it. And tomorrow we will be talking about Mediterranean diet right here. And Mediterranean diet is a diet that is frequently recommended for people with type 2 diabetes. So we'll be talking about the benefits of the Mediterranean diet. So I will see you here tomorrow at 2:30 Pacific. Bye.